Hey everyone, large language models, LLMs. You've probably heard the buzz, especially when it comes to medicine. We're talking about AI that could actually revolutionize healthcare.
And we're not just talking about simple chatbots here, right? This is next level stuff.
Exactly. And to guide us, we're doing a deep dive today into, get this, a survey of large language models in medicine, progress, application, and challenge.
Dense title, but it's a treasure trove of info.
It really is, and we're breaking it down. Get this, we're talking AI acing medical exams, almost like they went to med school themselves.
It's wild. Could we see AI diagnosing patients alongside doctors someday? Maybe even suggesting treatment options.
It's mind-blowing. But before we get ahead of ourselves, let's back up. What even are these LLMs? How do they process language so well, almost like a person?
Right. So the magic, and I say that in quotes, lies in how they're built, the data they use, and how they're trained. Imagine this transformer architecture.
Yeah.
That's the engine, okay? It helps them understand how words relate, almost like they get the nuances of human conversation, which is insane.
Okay, so they're not just seeing words in isolation anymore. They get the context.
Exactly. But even the best engine needs fuel, right? Enter massive data sets. We're talking billions, trillions of words fed into these models. Think medical textbooks, journals, patient records. It's like a digital library of medical knowledge that they devour.
A crash course in medicine, but at warp speed.
Exactly. And here's the kicker. They need a goal, right? This is where training objectives come in. Do you want the LLM to be amazing at diagnosing from images or summarizing research for doctors?
So it's not just the information, it's how they learn to use it.
Exactly. And that's a key takeaway from this paper. It's not one size fits all. It's a whole family of LLMs, each with its own thing.
Like a family reunion. And speaking of families, figure 2 in the paper blew my mind. All these different medical LLMs. We've got BERT-like models, ChatGLM, LEM-like, GPT-PaL-M-like. It's like a medical conference in here.
And each LLM architecture, just like a specialist, has its own strength. Some are great with medical language, others with generating text. Some handle huge chunks of information. It's incredible.
Incredible. And the training, it's fascinating how they learn all these different methods.
Right. The paper outlines pre-training, fine-tuning, and prompting. Think of pre-training like med school for LLMs. It's all about building that foundational medical knowledge.
Got it. So that's med school. But what about specializing, like becoming a radiologist or something?
Perfect analogy. That's where fine-tuning comes in. It's like residency. Take that pre-trained LLM, train it further on, say, tons of x-rays, and bam, you've got yourself a radiology specialist LLM.
AI specialists.
Yeah.
Just like us humans. Mind-blowing.
Right. And then there's prompting, which is fascinating. It's like giving the LLM a specific instruction, like, here's a patient's history, tell me the risk factors, like a case study.
Oh, that's super practical.
Right.
Especially in a real clinic, helping doctors make decisions.
Exactly. But here's the thing. All of this training, it takes serious resources. Not every research team has access to that kind of power, which affects what's possible.
It's like the difference between a small clinic and a huge research hospital. Right. Resources matter. So we've got these brainy LLMs soaking up info, but can they actually put it to the test? Could they pass the doctor test, so to speak?
It's $1 million question, right? And this paper dives into that. It looks at how LLMs perform on different medical tasks, comparing them to, well, us.
Spill the tea. How do they measure up?
Get this. Surprisingly well, especially with things like answering medical questions, summarizing research. Figure 3 shows this. Some LLMs, even general ones like GPT-4, are acing these tests.
It's like they've memorized a whole library and can recall it perfectly.
Exactly. But it gets more interesting. While they excel at this information stuff, they hit a wall with those more nuanced aspects of medicine.
Nuances. What do you mean? Like, where do they fall short?
Think complex reasoning, making judgment calls with limited info, or even just the emotional side of interacting with patients. That's where human doctors still have the edge, and the paper shows this really clearly in figures 3 and 4.
So they can ace a multiple-choice quiz, but can't quite replace that human touch. I have to admit, that's a relief.
Right, and that's a key point. These LLMs are tools, powerful tools, but still tools. They help us, not replace us. They can make doctors better, improve care, but it's about collaboration.
AI and human expertise joining forces. I like the sound of that. Okay, so they're learning machines, but how are they actually being used out there in the real world? That's what I really want to know.
That's where section 4 of this paper gets really cool. It goes from the theoretical to the practical, how medical LLMs are making a real difference.
Let's hear it. Give me the real-world applications. Don't hold back.
All right, so they highlight 7 key areas. Figure 5 is great for visualizing it. Medical decision-making, streamlining that whole coding mess, creating patient reports, even, wait for it, medical robotics.
Hold on, robots. As in robots doing surgery with the help of AI. That sounds like something out of a movie. Tell me more.
It's early days, but the potential is mind-blowing. Imagine a future where surgical robots use LLMs to process data in real time, assisting surgeons with incredible precision.
That's revolutionary. Okay, but let's step back from the future for a second. What about right now? How can LLMs impact patient care today?
One area where they're already making waves is inpatient discharge summaries. Think about it. You leave the hospital after something complex, bombarded with jargon, and LLM could take that and make it clear, concise, easy for anyone to understand.
No more deciphering doctor handwriting. That's huge for patients.
Huge. And that's just one example. The paper goes deep on the challenges and opportunities for all 7 applications, even gets into specific LLMs and how they're evaluated. Check out Table 3 for that.
It's like LLMs are already making their mark, and we're just at the beginning. This is incredible.
It is exciting. But like any powerful tool, we got to be careful, right? With great power
Comes great responsibility. We can't just ignore the potential downsides, right? What are some of the concerns with medical LLMs that we need to be thinking about?
That's really important, and the paper dives into that in Section 5. We're talking ethical considerations, and it's a conversation we need to have.
Okay, so ethically speaking, what are the red flags, the things that make you go, we need to be careful about this?
One major one is bias. LLMs are only as good as the data they learn from. If that data has biases, like, say, it mostly represents a certain group of people, the LLM might make biased recommendations without even knowing it.
That's scary. Like, if it's mostly trained on data from one type of person, it might not be accurate or fair for others.
Exactly. And that's just one example. There's also the issue of data privacy, especially with medical info, which is super sensitive.
These are big issues. So how do we make sure these LLMs are developed responsibly and used ethically? What's being done?
Researchers and developers are very aware of this and are working on solutions. One thing is improving the data itself. We need data sets that reflect everyone, all backgrounds, to minimize bias and make sure it's fair.
So more inclusive data equals a more fair and effective LLM for everyone.
Exactly. There's also a big push for transparency. Can we understand how the LLM reached its conclusion? This is key for trust and knowing it's making good decisions.
Right. It's one thing for AI to give an answer, but I want to know why it gave that answer.
Absolutely. And this ties into the idea of human-in-the-loop systems, where LLMs are tools to assign doctors, not replace them. It's the best of both worlds, combining AI and human expertise.
So it all comes back to collaboration. It's not about AI versus humans. It's about AI working with humans. So we talk about the present, but what about the future? This technology is evolving so quickly. What's next? What does this paper say about what's coming down the pipeline?
Fasten your seatbelts because Section 6 is like a peek into the future, and it is wild.
Hit me with it. What mind-blowing advancements are on the horizon?
One of the coolest things is multimodal LLMs. Remember how we said they mostly process text right now? Well, imagine LLMs that can handle medical images too. X-rays, scans, even videos.
Whoa, it's like giving them superpowers. Being able to analyze all that visual data along with the text, that's next level.
It's a game changer. Imagine an LLM looking at a patient's history, their genes, and their latest scan all at once to give a comprehensive picture of their risk for certain diseases.
The possibilities for personalized medicine are endless.
Exactly. And there's more. The paper talks about medical agents, basically AI assistants for doctors.
So like a doctor's personal AI sidekick, helping them with research, diagnosis, all of it.
Precisely. Imagine an LLM that can scan all the latest research, check for drug interactions, and give the doctor the key info, all while the doctor focuses on the patient.
It's like having a team of experts on call 24/7.
And it's not just for doctors. These agents could also empower patients, giving them info and guidance. Imagine an LLM answering your medication questions, tracking symptoms, even connecting you with support groups.
That's amazing. Especially for people who maybe don't have easy access to doctors or reliable information.
Right. It's about making healthcare more accessible. But, and this is important, we need to do it right. We can't just let tech companies decide how this goes down. We need doctors, ethicists, everyone to make sure it benefits everyone.
It's about finding that balance between pushing boundaries and being responsible, making sure this technology is used for good.
Exactly. And the paper stresses that. It's a call to action. We all have a role to play in shaping this technology.
So what's next? What can we do as researchers, policymakers, even everyday people to make sure this technology is used the right way?
That's the question, isn't it? And we'll unpack that more as we go. But for now, I think the most important thing is to stay informed, engaged, and curious.
Curiosity. I love it. That's what drives progress, especially in areas as complex as medicine and AI.
Exactly. And that's what this whole deep dive is about, getting people curious, giving them the information, and then empowering them to be a part of this amazing future of healthcare that's being shaped right now. And speaking of shaping the future, this paper, it doesn't just raise questions, it highlights what's being done to make sure these powerful tools are used the right way, responsibly.
Okay, so give me some examples. What are people doing to address those potential risks we talked about? Because honestly, that's what's been on my mind.
One of the big things is this push for explainable AI. You see, right now, some LLMs are like a black box. They give you an answer, but you don't know how they got there.
Right. And especially in medicine, you need to know the why behind a diagnosis or a treatment. Blind trust in AI just doesn't sit right.
Exactly. So researchers, they're working on LLMs that can not only give you the answer, but also explain their reasoning. And not in some technical jargon, but in a way anyone can understand.
That would be huge, both for doctors who need to trust the LLM suggestions and for patients who deserve to know what's going on.
Absolutely. And it's not just about transparency for individual cases. It's about making sure these LLMs are fair and unbiased across the board.
Okay, so how do you teach fairness to an AI? That seems like a very human concept.
It's a tough one, but it comes down to the data. Think of it like this. If you train an LLM on biased data, let's say, medical records that mostly represent one group of people, it might make biased recommendations without even realizing it.
Garbage in, garbage out, as they say. So how do we make sure the data itself is fair and represents everyone?
That's where things get really interesting. We need everyone at the table: ethicists, social scientists, data scientists, and of course, the medical experts. They need to work together to build data sets that reflect the real world with all its diversity and address any potential bias right from the start.
It's like we're building a more fair healthcare system from the ground up, starting with the very data that fuels these AI tools. I like it.
Exactly. And it doesn't stop there. It's not a one-time fix. We need constant monitoring, constant assessment. Are these LLMs staying fair? Are there any hidden biases creeping in? It's an ongoing process.
It makes sense, especially with how fast the technology is changing. You got to stay vigilant.
Absolutely. This paper really emphasizes that point. It's not enough to build these LLMs and then just, hope for the best. We need oversight, ethical reflection, and a commitment to using them in a way that benefits everyone.
And that brings us back to that fundamental question we touched upon earlier. With all these advancements, what happens to the doctor-patient relationship?
Right, that's the big one. And it's something people are understandably worried about. Will AI replace doctors? Will it become this cold, impersonal experience?
Yeah, I get it. The human touch, empathy, really listening to the patient. That's so important in medicine. You can't just replace that with an algorithm.
Absolutely. And that's why I believe the future, the best future, is about collaboration, not replacement.
Okay, so not AI doctors, but doctors with AI superpowers.
Now you're getting it. Imagine doctors using LLMs to handle all that data analysis, research, even generating potential diagnoses, freeing them up to spend more quality time with their patients.
It's like giving them an extra set of hands and a super brain all at the same time.
Exactly. Think about what that could mean, especially for patients who don't have easy access to specialists or the latest treatments. LLMs could help bridge that gap, making sure everyone gets the best possible care.
That's a future I can get behind. Using technology to make healthcare more accessible and equitable for everyone.
That's the goal. And this paper really drives that point home. It's not about replacing human judgment or compassion. It's about combining the best of what humans and AI can do.
It's a message of hope, for sure. But we can't just sit back and expect this perfect future to happen on its own, right?
Exactly. We have to actively shape this technology. We have to make sure it aligns with our values, our ethics, and our vision for a better future.
So what can we actually do? What concrete steps can we take as researchers, policymakers, even just as concerned citizens to steer this in the right direction?
That's the question, isn't it? We'll dive into some specifics later, but for now, I think the most powerful thing we can all do is stay informed, stay engaged, and stay curious.
I love that. Curiosity, the engine of progress. Especially these fields that are changing so rapidly, you got to keep learning, keep asking questions.
Couldn't agree more. And that's what we're trying to do here, right? Spark that curiosity, equip people with knowledge, and empower them to be part of this amazing transformation that's happening in healthcare right now.
We've covered a lot of ground already, but there's one thing you mentioned earlier that I want to circle back to, the idea of LLMs empowering patients directly.
Yes. This is close to my heart. It's about giving patients access to knowledge, making healthcare more democratic.
Okay, paint me a picture. What does that actually look like? How can patients use these LLMs to take charge of their own health?
Okay, imagine this. You're at home, not feeling great, not sure if it's worth a trip to the doctor. But instead of Googling your symptoms or waiting forever to talk to someone, you consult your personalized health assistant.
Wait, like I have a personal AI doctor on my phone?
Sort of. It's an LLM that knows your medical history, your family history, even your lifestyle, based on all that data we talked about.
So it's like having a complete picture of my health that's constantly being updated and analyzed.
Exactly. And with that knowledge, it can answer your questions about your symptoms, give you evidence-based advice, and even tell you if it's time to see a real doctor.
Wow, that would be huge for people who have trouble navigating the healthcare system, or maybe they just don't have easy access to doctors.
Absolutely. And even if you do need to see a doctor, this LLM assistant could create a summary of your symptoms, making your appointment more efficient.
Like having a personal advocate, making sure your voice is heard. I love it.
And it goes beyond just symptoms. These LLMs could help people understand their medical conditions, their treatment options, connect them with support groups. It's about empowering them with knowledge.
Knowledge is power, right?
Right.
Especially when it comes to your own health.
Exactly. And it could lead to better outcomes, happier patients, and a more patient-centered healthcare system.
That's the dream. But realistically, how do we overcome the challenges? What's standing in the way of making this a reality?
One of the biggest hurdles is making sure everyone can actually access these tools. It can't just be for people who are tech-savvy or have a lot of money.
Equity and accessibility from the get-go, that has to be a priority.
Absolutely. We also need to be incredibly careful about data privacy. Medical information is sensitive, so security has to be top-notch.
And we can't forget about the human element. As amazing as technology can be, not everyone wants to talk to a machine. These LLMs need to be designed to work alongside humans, not replace them.
100%. It's about finding that balance, using technology to enhance, not erase, the human connection that's so essential to healthcare.
It's about finding that sweet spot where AI and human expertise complement each other.
Exactly. And this paper does a great job of highlighting that balance. It's not just about the tech, but the ethics, the social impact. It's a roadmap for doing this right.
This has been eye-opening. This paper, it really makes you think about the future of medicine in a whole new way. But before we wrap up, there's one more thing I wanted to circle back to. We talked about those new benchmarks, those ways to evaluate LLMs for medicine.
Right, making sure they're up to the task.
Exactly. But what do those benchmarks actually look like? What are we testing for?
That's a great question, and it gets to the heart of what makes medical AI so tricky, so important. We're not just testing if an LLM can memorize facts or do math. We need to know if it can reason, make judgments in complex situations, and communicate effectively with both doctors and patients.
So it's not just about multiple choice questions anymore. It's about assessing their ability to actually think like a doctor, in a way.
In a way, yes. And this is where the expertise of doctors and other healthcare professionals is absolutely essential. We need to design these benchmarks together so they reflect the realities of working with patients.
It's like creating a whole new set of standards for what it means to practice medicine in this age of AI.
Exactly. And these standards need to evolve as the technology evolves, which means constantly updating them.
That makes sense. But how do we make sure these benchmarks are objective? Medicine is so complex, there's got to be some subjectivity there.
You're right, it's a valid concern. That's why transparency and collaboration are key. We need to be open about how we're evaluating these LLMs and work together as a community to establish standards that everyone agrees on.
So it's about creating a level playing field, making sure everyone is held to the same high standards.
Exactly. We're setting the bar high and then raising it as the technology improves.
It's like we're on this exciting but also kind of unknown path. We need to keep checking our compass to make sure we're headed in the right direction.
I love that analogy. And this paper, it's like our compass. It gives us the information and guidance we need to navigate this new landscape.
This paper has been incredible, really thought-provoking. But as we start to wrap up, I have one last question, and it's a big one.
Go for it. I'm ready.
We've talked about how LLMs could revolutionize healthcare. But what does it say about us? What does it say about how our understanding of intelligence itself is evolving?
Wow, that's a deep one. It's a question philosophers and scientists have been debating for centuries. But I think LLMs, especially in medicine, are forcing us to expand our definition of intelligence.
Why so? In what ways do they challenge our traditional ideas about what it means to be intelligent?
Well, for a long time, we thought about intelligence as logic, problem solving, things like that. And while those are important, LLMs show us there's more to it.
What's the missing piece? What other kinds of intelligence are we seeing in these LLMs?
Think about their ability to process information. LLMs can analyze millions of medical records, studies, trials in seconds. A human brain can't even come close.
It's like they have this superhuman ability to absorb and make sense of huge amounts of information, right?
Exactly. That's a form of intelligence. It's not just about calculating. It's about seeing patterns, making connections, even being creative with solutions.
It's like they're teaching us new ways to think, new ways to solve problems.
Yes. And that's what makes this so exciting. We're not just building AI that copies human intelligence, but AI that can enhance our own abilities.
So it's not about AI versus humans, it's about AI making us smarter.
Exactly. And that's a message we need to shout from the rooftops. The future isn't about AI replacing us, it's about AI helping us become better.
It really makes you think, doesn't it? This whole idea of AI not just copying us, but actually changing how we define intelligence itself. Like we're seeing a new kind of intelligence emerge right before our eyes.
It's a remarkable time. And this paper does a great job of capturing that excitement, but it also keeps it real, you know? It brings it back to the practical challenges of bringing these tools into medicine.
And that's what I like about it. It doesn't sugarcoat anything. It's honest about the risks, the ethical questions, all the things we still need to figure out.
Exactly. And it's in that uncertainty where things get really interesting, right? It's not just about building a faster LLM. It's about asking ourselves, what kind of future are we building with this technology?
That's the question, isn't it? And it's not just for the tech people to answer, it's for all of us. The choices we make now about how we develop and use this stuff, they'll have huge implications down the line.
No doubt about it. And that's why these conversations are so important. We need different voices, different perspectives. We need to question everything and be open to the idea that this technology, it could change everything, not just medicine, but our whole understanding of ourselves and the world.
It's both thrilling and a little intimidating, right? Like we're standing on the edge of something massive, and the choices we make now, they determine what that something becomes.
Absolutely. And that's why we need to be cautious, but also open-minded, to be aware of the risks, but also ready to embrace the possibilities.
It's like walking a tightrope. We're balancing the excitement of discovery with the responsibility of making sure this technology is used ethically, that it benefits everyone.
Perfectly said. And it's a balancing act we'll constantly be adjusting as we learn more, as the technology gets better, and as our understanding of intelligence itself keeps evolving.
This deep dive has been amazing. It's really opened my eyes, not just to the technical stuff, but also the bigger picture, the philosophical questions these LLMs bring up.
It's been a pleasure exploring all this with you, and I hope our listeners are feeling inspired to learn more, to ask those tough questions, and to get involved in shaping what comes next.
Because the future of medicine, it's not something that just happens to us. It's something we create together. And it starts with being informed, being ethical, and having a shared vision for a healthier, fairer world for everyone. Thank you so much for joining us for this incredible deep dive into medical LLMs. We'll be back with more soon, so be sure to subscribe and stay tuned.